The new Trump budget whacks a bunch of stuff. We'll talk about a key program tonight.
The Dan York State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
And remember, presidential budgets, especially first-year budgets, usually end up in the guillotine anyway. But there's a conversation going on out of Washington, other than all of the hullabaloo that we deal with every day, about policy and whether some programs are actually worth spending the money on. We have a smart person on the return on investment on things like Meals on Wheels and the like coming up here this evening, so do not go anywhere. We'll meet our guests coming up in just a matter of moments, but let's go to the rundown and find out what's happening here. And boy, oh boy, the thumb was working again. Donald Trump back at it, full screen of tweets all over. Rather than reading them all, why don't we just report on them all?
President Trump took to social media Monday suggesting the House Intelligence Committee investigate Bill and Hillary Clinton's alleged ties to Russia, tweeting, "Russian speech money to Bill, the Hillary-Russian reset, Trump-Russia story is a hoax." The late-night rant came amid growing calls from House Democrats for the Republican chair of the committee, Devin Nunes, to recuse himself from its Russia probe into Trump associates.
Enough question has been raised in the public about whether he can lead a credible investigation in this.
On Monday, Representative Nunes acknowledged he had a secret meeting with an unidentified source on White House grounds last week, during which he says he viewed highly classified documents about Mr. Trump's surveillance claims. Nunes then briefed the president about it before talking to members of his own committee.
I'm sure that the Democrats do want me to quit because they know that I'm quite effective.
The development came on the same day the president's son-in-law and senior advisor, Jared Kushner, voluntarily agreed to be interviewed by Senate lawmakers as part of their probe into Russian meddling in the 2016 election. This amid revelations Kushner sat down with Russian Ambassador Sergei Kislyak at Trump Tower during the transition and met with the head of a Russian bank with deep ties to President Vladimir Putin and Russian intelligence agencies.
That was part of his role, and he executed it completely as he was supposed to.
A date for Kushner's testimony has not been set.
All right, that's a lot to digest, but the moral of the story here is that Donald Trump continues to try to, I don't know, just tweet his way out of whatever jam he may or may not be in. Well, don't you just kind of long for a president who will try to stay above board, cooperate if there's nothing wrong, and instead deflecting and telling more stories with his fingers doing the walking? Panhandling problem here. This is a non-stop conversation. We've been talking about this here on the radio, on WPRO, weekdays 3 to 6, and everywhere else for too long a period of time. Pro-Joe headlines, you know, regarding this. It's just a chronic situation. And in Cranston at the Sakanasa Crossroad, the cops are really getting tough.
In the midst of Monday's ride home, a few dozen activists coordinated through the state's Homeless Bill of Rights Defense Committee fill each corner of Sakanasa Cross Road and New London Avenue.
I'm out here to exercise my First Amendment rights and to show my opposition to the ordinance.
Horowitz tells us he's dedicated his entire career to issues of social justice for those in need. He calls Cranston's recent roadway safety ordinance unconstitutional, a public guise to suppress the face of poverty and homelessness.
I was there for all of the hearings at the City Council, and that's plainly what this ordinance is designed to do, to try to remove from our vision poor people and people who are struggling, and I think it's exactly the opposite of what we should be doing.
Cranston Mayor Alan Fung couldn't make it to Monday's demonstration, but his office did say they continue to stress there is no ban on panhandling in Cranston. Instead, the ordinance passed in February restricts transactions in the roadway itself, but some say that's still too much.
I don't think that any ordinance that attempts to criminalize any behavior that individuals have to engage in to survive when we have such a broken safety net is ever going to be functional.
While the past ordinance, which is currently under review by the ACLU, points to public safety issues associated with panhandling, Smith tells us she doesn't believe that's the issue at hand. She says this is an attack on First Amendment rights, a way to criminalize the homeless and the poor.
If we're looking at what's dangerous, it's homelessness that's dangerous, not standing in a median and trying to survive.
Yeah, this is just irresistible force, immovable object. It's just an almost impossible scenario to get a handle on it. By the way, I keep saying this, we need a statewide piece of legislation on this so that these issues don't move from one town that gets tough on it to another. I have empathy for those who are, you know, making a legitimate claim for help. By the way, the Cranston cops, I guess, were trying to prove a point yesterday. They ticketed 2 media people in covering the story, including our own Steve Klampkin at WPRO. I got to get the skinny on that and report back to you. Statewide policy, statewide enforcement, I think is, you know, the best alternative. But we need to think it through because there are significant First Amendment rights that are in jeopardy here. We'll bring Professor Horowitz on sooner or later to get his perspective, and perhaps the other as well. Quick note, there's a story that's kind of getting a lot of attention under the concept of cop and cocaine. WPRI.com reporter Dan McGowan, or is it Walt Buteau? I think Walt Buteau actually on Target 12 ran this piece. The police union is having a problem with the idea that a young man who is now 30, but who was jammed up for a cocaine sale back at the age of 19 has become successful within the police academy. He's going to be a cop. I guess there were only 60 that were accepted to the academy out of some 2,000 applications, and the theory always is that you got to know a guy. But I will tell you, you can't have a felony and be a police officer, convicted. But he wasn't convicted. He was kind of met halfway in the middle by a program that intervened young people's efforts with drug sales. And it seems to me that if you've got a guy who's turned his life around and wants to be a police officer and gets it on the ground as to what it's like out there in the, quote, real world of drug trafficking, that would be an asset, not a liability. We'll dig into that, too, over the next few days and get some answers on that. In the meantime, one other note, the RIPTA folks, did you see the story yesterday in the Providence Journal? This is just ridiculous. I said this when they did this. So it used to be that there was a no-charge bus fare for those seniors and handicapped. Handicap's the wrong word these days, right? What's the word? Disabled. The disabled, yes. We must be correct when we say this. The disabled and the seniors were able to get on the bus for nothing. Now they find that there are hundreds that are missing from various scheduled soup kitchen meals and the like all across the city and the state, because people don't have the 50 cents to get on the bus. Look, I don't understand why there's so much pressure to make a profit on the public transit system. No public transit system makes money. Now you got to run it efficiently, and if there's waste and fraud and all that kind of stuff, well then get on it. But jamming up the people who can least afford to be jammed up, it's counterintuitive to what a public transportation system is supposed to be. And they ought to throw this idea out and go back to the note, make sure that those who are getting free rides are verified to deserve it and are under the poverty line. But heavens, what do you have public transportation for? All of us, you know, who run around in our cars jamming up the highways, you know, have this, you know, nose in the air disposition about this. It's outrageous. Speaking of programs, you guys are going to call me a bleeding heart liberal by the time this whole show is over. There's no doubt. Look at this headline in the Providence Journal. I'm sorry. This is actually Money Magazine. And this is some of the rhetoric that's coming from the Office of Money at the Trump administration.
$3 billion would be cut from community development block grants that help fund programs like the Meals on Wheels network, which receives over a third of its funding from the federal government. The organization defended its services, saying it serves meals to 2.4 million seniors each year, including 500,000 veterans.
We can't do that anymore. We can't spend money on programs just because they sound good and great. Meals on Wheels sounds great.
Meals on Wheels sounds great, just not getting it done. Yes? No, Professor?
Well, I've been conducted a number of studies over the past few years that do suggest that home-delivered meals has positive impacts for both clients and the state and federal budget.
Meaning it's a return on investment?
That is what we have found, yes.
When we come back, Professor Callie Thomas will explain what she means with her data. In the meantime, I just want to remind you that if you're banking these days and looking for a level of sophistication, Navigant Credit Union has now upped its game with the Card Valet app. So you put it on your phone and it tells you everything that's going on with that debit card or credit card to the point where no detail is left unturned, not only for that, but for all of your banking. So In the world of trying to get more and more sophisticated, Navigant Credit Union puts its nose out front here with this technology. You got to check it out at navigantcu.org. Right back with the professor on why Meals on Wheels is actually a good investment. Stay with us. All right, so here's a report that Eyewitness News did on the local impact of Meals on Wheels.
Before he could even knock, 79-year-old Becky Yates had the door wide open to her Warwick home to greet U.S. Senator Sheldon Whitehouse.
Double duty today.
The senator, home from D.C., delivered her Meals on Wheels Monday afternoon.
I wouldn't be eating if I didn't have Meals on Wheels.
The program's been in the national spotlight after the president's administration announced their proposal to increase defense spending and cut many other programs.
And we're going to make sure this program stays for you and lots of other people.
That potentially includes a funding source for Meals on Wheels. White House Budget Director Mick Mulvaney says it hasn't shown results.
We can't do that anymore. We can't spend money on programs just because they sound good and great. Meals on Wheels sounds great.
It's actually really simple. You deliver a hot meal and give a visit to a lonely senior. There is no trick. It's just that, but it's worth doing.
In Rhode Island alone, the program delivered more than 327,000 meals and also does safety checks. Yates didn't know something that she called everything to her was suddenly at the center of a political fight.
Oh, really?
Don't worry, it won't happen.
We're going to be here for you.
I don't know how the senator found that particular woman, but they always find a way to try to personalize the controversy. So, Professor, tell me, the rhetoric out of the Trump administration now is that it's really just kind of a bleeder, right? So you tell me why it's not.
Well, how about I start at the beginning
Sure.
to tell you how we came to be here today with a number of research studies documenting the impact of home-delivered meals.
Okay.
So in 2012, as a health services researcher and gerontologist, I've long been interested in this population of nursing home residents whose needs could perhaps be cared for in the community. And we had lots of research on how spending on Medicaid, home and community-based services, and assisted living was related to this population of low-care residents in nursing homes. But what had not been documented was the impact of social services and spending on programs like home-delivered meals and its relationship to low-care residents. So in a paper that we published in 2012 with my colleague Vince Moore, we examined state spending on social service programs funded through the Title III of the Older Americans Act. And what we found was that over a decade, states that increased spending on their home-delivered meals programs saw reductions in their population of low-care residents in nursing homes. And I can remember the first time I presented these results to one of my colleagues, and she scratched her head and she looked at me and said, "I don't quite get it. How are meals keeping older adults out of nursing homes?" And so, having actually been a Meals on Wheels volunteer and the granddaughter of a Meals on Wheels client, I said, you know, the meals that are provided, the services that are provided through this program provide more than just nutrition to clients. As was mentioned in the news clip, the volunteers who deliver meals check on clients, they report any changes that they see, they conduct safety checks, and any unanswered delivery is followed up on and investigated. And so
why would anybody with half a brain actually look? I would ask you to provide the data to support your thesis, but I wouldn't question the common sense nature of it. So whoever you were speaking to, oh my gosh, well, no blanks, Sherlock. I mean, if somebody who is, you know, elderly and alone is getting human interaction and nutrition, those are two key elements to their quality of life. And most people want to stay in their homes.
That's true.
So you make perfect sense. You just had to do the research.
Exactly.
Okay, and the research says what?
The research says in a follow-up study that we conducted that we estimated that states if they were to increase the population who they served home-delivered meals, they would actually have the potential to recognize savings to their state budget through keeping these low-care residents out of nursing homes. So we estimated that a 1% across-the-board expansion in the program would have equated to over about $109 million in savings to Medicaid programs. And
what's the 1% equivalent to? Like in Rhode Island or Mass, do we know what that?
So in Rhode Island, it was 1,500 additional older adults would receive home-delivered meals.
And what's the cash expense attributed to that? Do we know?
So it's the average. We utilize the average cost per meal,
Which is?
Around. It varies. In fact, I believe it's $7, but you'd have to ask a program to give you the exact number.
All right, so $9,000 a day. I mean, you're saying there's $100 million of potential savings in Rhode Island, or
that was across the country.
Across the country.
In Rhode Island, in fact, our estimates from these models suggested that an additional 1,500 meals that were served to older Rhode Islanders would have equated to about $100,000 in savings to the state budget. But keep in mind, this is through
net?
Yes, net savings. This would be through increasing spending on home-delivered meals and a 1% across-the-board expansion, which, as we know, because of federal regulations, that these meals would be targeted to those most in need.
And Meals on Wheels is an exclusively federally funded program?
So meals, about 30 to 35% of the budget for Meals on Wheels comes from the federal government through Title III funding for the Older Americans Act.
Right, so if they knock it out, which I doubt they will, but if they, because when Congress gets a hold of this, it's a tough one, right? Meals on Wheels is a very popular program, right? But even on the state side, I mean, the state might have to be picking up a whole bunch of stuff. I mean, the healthcare initiative, went splat on Friday, but there's near $100 million worth of Medicaid differential when it comes to the state of Rhode Island. We're going to have a heavy political conversation as to whether or not we want to fill that void, as 50 other states are going to have to try to figure that out. Same too with this kind of a program, seems to me. But if there's a net savings, how can you not?
Right.
When we come back, we'll see if the professor's research is actually getting through. Is anybody listening? Stay with us. All right, so you're telling me that the Meals on Wheels program not only pays for itself, but actually cuts the cash flow expense for nursing home aid, correct?
Correct. That's what our research has
What
suggested.
what other kinds of programs or other kinds of data do we need to know about this? Because I think most people just think it is a thing we do with vapor in terms of a calculation on return, right? What else do we need to know?
So I think it's important to know that our research suggests that it has, that additional work that we have done suggests that it has outcomes that are directly related to healthcare expenditures, as well as participants' quality of life and well-being. So in a study we recently completed with Meals on Wheels America, which was a randomized control trial and is considered one of the most rigorous types of research evaluations for programs, we found that individuals who received daily delivered meals or once weekly delivered meals had reductions in their feelings of loneliness, and that those who had daily visits from their meal delivery driver had increased rates of reductions in their loneliness. And loneliness sounds like a nice warm and fuzzy outcome, but it's actually been directly linked to health and mortality. So in a recent study, it was estimated that older adults who were lonely were at two times the risk of premature mortality compared to older adults who were obese or smoking. So in other words, being lonely was more dangerous for your health than smoking or being overweight. We also found in the same study that participants who received home-delivered meals were at decreased rates of falling during the study period compared to a control group that didn't receive meals. And falls, as you know, is a public health concern. It's the #1 cause of both fatal and non-fatal injury among older adults. And in 2014, I believe it was estimated to cost the Medicare program $31 billion
I don't think
in Medicare costs.
I don't think that data has resonated amongst the population. That falls. The senior population certainly knows, and those who are taking care of their mom and dad certainly know. But I don't think that you see a couple infomercials every once in a while on the cable networks regarding seniors falling down and medical alert sounders and bracelets and all that kind of thing. But this is information that I think probably needs more exposure, a la you being here. It's really interesting. There are so many arguments for social services and the support of social services. It's hard for people like me who try to break this stuff down, and for everyday people who vote and have a thought on taxation and budgetary spending. What is really the thing that returns investment, saves other kinds of costs, or just a throwaway program that we've always done? It's very hard across the spectrum of social service to figure out what keeps a social service industry busy for the sake of it and what actually means something, right?
Correct. Well, I will say that our research suggests that the federal contributions to Meals on Wheels gives the federal government a pretty good deal. So 30% of funds that are provided to Meals on Wheels programs 30 to 35 come from the federal government. Of those, 15% are required to be matched by states. These programs are also funded through legions of volunteers who are delivering meals and helping in the kitchen and helping in the office free of charge. And our research suggests that the outcomes from these programs can potentially reduce healthcare costs as well as adverse health outcomes that are directly attributable to increased spending in healthcare costs.
So what are you doing other than Dan York's State of Mind here to get traction on these arguments? What's the PR play for this data?
So we have been actively disseminating these results to various stakeholders, working closely with the media team, both at Brown University as well as Meals on Wheels America, which is the National Association for Home Delivered Meals Programs, and getting the word out there, speaking to policymakers, coming on shows like yours, and sharing this work.
Yeah, I just wonder whether we're going to get into a really big conversation in America with potential significant cuts coming down from the federal government. And states having to make some really interesting, independent, creative decisions to sustain some of the things that are partially or fully federally funded. It's going to be an interesting next 3 or 4 years, don't you think?
It will be, indeed.
How many state hearings do you think you'll be attending when these? I mean, your input's going to be valued. You're going to be up at Smith Hill, arguing these points.
So to the extent that they can be helpful, absolutely. And that's something that we've been involved with in the past. As the state of Rhode Island, the program here was trying to get its funding restored to what it was in 2008. And thankfully, in the last year or two, the funding has resumed to the levels it was almost a decade ago. But we're still not paying the prices, and the need has increased.
Well, we're going to have to throw out the concept of Meals on Wheels Lex on the radio and see what kind of response is. My guess is it's a hot button. For people who know it and love it, they'll fight for it. We'll see how that goes. We'll have you back as the argument continues. Thank you.
Thank you.
Appreciate it, Professor. Final word, and we come back. Stay with us. It's a struggle to try to figure out what's just a wasted social service government program and that which is a return on investment. But my guess is I go on the radio and ask you about cutting Meals on Wheels, that the you-know-what will hit the proverbial fan. I think we'll test it. Thanks for tuning in. Don't forget, 3 to 6 on WPRO. We'll see you back here tomorrow night. Good night.